we can study about the histology of ovary. So already the ovary, that video is already over. So today now we can study about the histology of the ovary. Then this histology of ovary, this is the section of ovary. Here we can see the ovary is covered by the bordal epithelium, that is known as germinal epithelium, the bordal epithelium. Okay. And inside the epithelium, the substance of the ovary is divided into a central part that is known as medulla and the outer part that is known as cortex and medulla. The cortex, we can see there are so many stages, all stages of ovum, that is development of the ovum. Ovum along with the ovarian follicles, surrounding cells, they are known as follicles. Here we can see this is the ovum, and surrounding the follicular cells, they are known, this structure is known as a follicle. So there will be primordial follicles, primary follicles, secondary follicles, and tertiary follicles or Graafian follicle. Then so here primordial follicles, these are the small, see these are the primordial follicles, they are the smallest follicles, primordial follicles. Okay. Then these primordial follicles will undergo maturation and it forms the primary follicles. Primary follicle, this one. These are the primary oocyte and primary follicles. Primary follicles, this one. Okay, then these primary follicles undergo some changes and forms the secondary follicles. That is, some cavities inside the follicular cells will form, and the cavities filled with some fluid. Okay, they forms the secondary follicles. They are the secondary follicles, and this again it will enlarge, and finally this ovum can be seen, primary oocyte can be seen towards the peripheral part of the follicle, and there is a large cavity. So this is the Graafian follicle. Okay. After the formation of this Graafian follicle, this undergoes ovulation at the 14th day. Okay. Then this part of our ovary will burst out, and it ejects the ovum outside. Okay. So this ovum will be going out towards the pelvic cavity. Okay. From the pelvic cavity, it is sucked by the uterine tube. Okay. Then after ovulation, this Graafian follicle will be converted into another structure that is known as corpus luteum. Corpus luteum. Corpus luteum. This corpus luteum will shrink, and if there is any fertilization occurs, this will be retained for some time as the corpus luteum of pregnancy. Then if there is no fertilization, this corpus luteum again shrinks, and it forms a white fibrous tissue that is known as corpus albicans. Forms the corpus albicans. So this is the cyclic changes occurs in the ovary, and this changes is known as ovarian cycle, starting from the primordial follicle and ends in the corpus albicans or corpus luteum. The cycle is known as ovarian cycle, and this means 28 days. Okay. So within 128 days, there will be one ovum will be mature, and that will be eject out from the ovary, goes out from the ovary. That is process is known as ovulation. Okay, that occurs in the 14th day of the menstruation. 14th day of menstruation. Okay, onset of menstruation. So this is the histology of ovary. And in the center of medulla contains blood vessels and nerves. Blood vessels and nerves in the medulla. Okay. And coming to the applied aspect of the ovary. So this is our ovary. So coming to the, here we can see corpus luteum, corpus albicans, then Graafian follicles. Graafian follicle, that is tertiary. Then we have secondary follicles and primary follicles, primordial follicles, everything going to see. Like this it is arranged. So regarding the applied aspect for the ovary, so mainly we can see collapse of ovaries, that we already told, collapse of ovary. So during the pregnancy time, it will go up and when come back, it won't be there in the normal position in the ovarian fossa. And there will be ovarian cyst. That is another major problem seen in the ovary. So ovarian cyst. Ovarian cyst is formed by the if there is any problem with the development of these follicles. If there is any problem for this normal cycle, okay, for the formation of the follicle, so that part will be, the cells will get degenerated and fluid will be filled in that portion. So it will form a cyst. Okay. So that is known as ovarian cyst. So there will be more than one cyst can be seen in ovary, that is known as multiple cyst, multiple ovarian cyst. Okay, PCOD also in polycystic ovarian disease. So PCOD is one applied aspect for this ovary, and sometimes we can see there is endometrium. Then endometrium is usually is a part of our uterus, but some endometrial tissues can be seen inside the ovary, and it is seen as a chocolate color or brown color cyst can be seen in the ovary, and that is known as chocolate cyst. Chocolate cyst also can be seen in the ovary in some cases. And carcinoma of the ovary is also a common case, carcinoma, okay, for the ovary. So these are the applied aspect for the ovary. Okay. Now we can see the uterine tube. So next is the uterine tube. We can study about the uterine tube. Here we see this is the uterine tube. Uterine tube. Okay. So we can see it is attached to the uterus. Okay. Lateral angle of the uterus. So it is also known as fallopian tube. Uterine tube is also known as fallopian tube, and another term related to uterine tube is salpinx. Salpinx. And definition, it is a tortuous tube. You can see it is not straight. This side also you can see it is curved tube. Okay, so it is a tortuous muscular tube which conveys the oocyte. This is our ovary. So from the ovary will release ovum, and this ovum will be coming to the pelvic cavity, and from the pelvic cavity the uterine tube will sac the ovum, and it transfers the ovum from pelvic cavity into the uterus. So it conveys the oocyte from the ovary to the uterus. So that is its function. And the spermatozoa, which is introduced into the vagina, this is vagina. So spermatozoa, which is introduced in the vagina, it passes through the vagina, and then it enters through the uterine cavity, and it passes to the uterine tube. Okay, then it passes through the uterine tube, and that time if the ovum is coming through the uterus, from the ovary to the uterine tube, and at the part of the ampulla, this is the ampullary region. So at the region, this region, of sperm and ovum will fertilize. So the fertilization, this is the point of fertilization, that is ampulla of the uterine tube. Okay. So take place in this tube. So fertilization also take place in the uterine tube. Okay. Then situation. So it is seen in the upper border of upper margin of the broad ligament of uterus. So this yellow color portion, this is our broad ligament of uterus. So uterine tube is seen in the upper margin of the broad ligament of uterus, and it is about 10 centimeter long, and it has two ends, one lateral end and a medial end. Lateral end is free, and it has two openings. There is an opening in the lateral end, that is known as abdominal ostium, and another opening in the, here we can see another opening in the uterus, that is known as uterine ostium. So two opening, uterine ostium and abdominal ostium. Two openings are there, two ends are open, so that known as ostium. Opening is known as ostium. One is towards the abdominal cavity, that is known as abdominal ostium. Towards the uterus, it is known as uterine ostium. So two openings, and it has a diameter of about 3 centimeter, and it is divided into infundibulum, ampulla, isthmus, and a uterine part, interstitial part or uterine part. So it is divided into infundibulum. This is the infundibulum. So in the infundibulum, this is the Here we can see finger-like projections. The terminal end, lateral end of the tube is known as infundibulum, and in the infundibulum we can see the finger-like processes. They are known as fimbriae. Fimbriae. So among these processes, one fimbriae is large and seen towards the ovary. So this is known as ovarian fimbriae. Ovarian fimbriae. Okay. And this end of this end is known as infundibulum. Infundibulum. Yep. So that is the lateral end of the uterine tube. It's a funnel shape. Yes, funnel shape structure, and it contains finger-like processes known as fimbriae. One fimbriae is longer than the other, and it is known as ovarian fimbriae. This is the ovarian fimbriae. Then next part is known as ampulla. This is the ampulla. So major part, main part of the uterine tube. This is the ampulla. The part of uterine tube medial to the infundibulum is called ampulla. It is thin-walled and dilated and is tortuous. It is not straight. It is tortuous. And it is about 7 centimeter in length, 6 to 7 centimeter in length, and it arches over the upper wall of the ovary. It arches above the it arches above the upper wall of the ovary. Then ovary, and the ampulla is about 4 millimeter in thickness, diameter 4 millimeter, and this is the site of fertilization. So ampulla is the site of fertilization. Here we can see this one. So this part is the site of fertilization, ampulla. Okay, this is the site of fertilization. Okay. Then next part is the isthmus. This is the isthmus part. Isthmus. So this narrow, rounded, cord-like structure. It is narrow and it is rounded. It is a cord-like structure. Here you can see cord-like structure. Okay. And it is only about 2 to 3 centimeter in length. 2 to 3 centimeter. Okay. And this the fourth part is the intramural part or interstitial part or uterine part of the tube. So it is only 1 centimeter in length. Only 1 centimeter. Okay. So that can be seen inside the wall of the uterus wall. Up to here is actually the wall of uterus. So the part of the tube seen inside the wall of the uterus, that is known as intramural part or interstitial part, uterine part. Okay. And it opens into the superior angle of the uterine cavity. This is uterine cavity. So it opens into the uterine cavity through an opening that is known as uterine ostium. This ostium is about 1 millimeter in diameter, 1 millimeter, uterine ostium. It opens into the uterine cavity. This is the uterine cavity of the uterus. Then relations, the isthmus and the adjoining part of the ampulla is directed posterolaterally, and this part is related to our ovary. It is related to the ovary. See this one, here comes the ovary and arches over the ovary, and it is related to ovary. Uterine tube is related to ovary, and here we can see the part of broad ligament which is connected to the ovary and the uterine tube, between the uterine tube and the ovary. This part is known as mesosalpinx. This one. Mesosalpinx contains small tube-like structures. They are known as epiphoron. Contains epiphoron. This is epiphoron. Then blood supply of the uterine tube is supplied by uterine artery and also supplied by the ovarian artery. Same. This part is supplied by uterine artery, and here this will be supplied by the ovarian artery. Lymphatic drainage drains into the lateral aortic and pre-aortic lymph nodes. Okay. Then some lymphatics will drain into the superficial inguinal lymph nodes also. Superficial inguinal lymph nodes. Then nerve supply, sympathetic from the T10 to T12 L2 segments, T10 to L2 segments, and parasympathetic from the vagus. And also splanchnic nerves from S2 to S4 segments. That is the nerve supply. Then histology of the uterine tube. We are going into the histology of the uterine tube. showing one diagram. This is the section of the uterine tube. Here we can see there is a mucosa, innermost mucosa, and mucosa is highly folded. See, it is so folded, so highly folded structure. So it is mucosal folds can be seen. Then with the irregular lumen. See, the lumen is irregular. With an irregular lumen, and there is lamina propria. Outer there will be lamina propria, and it will be outer to the lamina propria comes the muscular layer. Muscular layer comprises of inner circular and outer, here we can see circular muscles. Inner circular and outer longitudinal muscles can be seen. Then outermost will be covered with the serosa. That is the histology of uterine tube. Then coming to the applied aspect of the uterine tube, the inflammation of the uterine tube is called salpingitis. Then sterility is the inability of the person with having a child is known as sterility. Then most cause of the sterility in female is the blockage in the tube. If there is any structure which produces the blockage in the tube, which result in the sterility, that means which prevents the fertilization. So if there is any blockage in the tube, it prevents the fertilization, resulting in sterility. Okay. And hysterosalpingography. So this is a hysterosalpingogram. Here we can see. So hysterosalpingography is actually a contrast X-ray radiological technique where we can see the cavity of the uterus and the uterine tube by injecting the dye, radio-opaque dye. Okay. So that is known as hysterosalpingography for detecting if there is any blockage in the uterine tube. Okay, so that is known as hysterosalpingography. And next is the tubal pregnancy. If the fertilization occurs in the uterine tube, okay, and if there is failure in movement of the fertilized egg towards the uterine cavity, the fertilized egg will be stay here and start growing here, resulting in the tubal pregnancy. Yep. Then tubectomy is usually we are doing the tubectomy for the family planning. So these women can be sterilized by removing a part of the uterine tube from both sides. So both sides, one part of the uterine tube will be cut and it will be tied properly to prevent the transferring of the ovum. Ovum can be transferred from one man to the other. So if we cut the tube and if we tie it on either side, because what will happen if this side the ovum will be placed in the pelvic cavity. So if only this tube is tied, this can passes through the pelvic cavity and reaches the opposite side and passes like this and reaches like this. Okay, causing again fertilization. So we have to tie both side of the uterine tube for the tubectomy. So that procedure is known as tubectomy. So these are the blood aspect for the uterine tube.